Welcome back to the show. Schools and mental health professionals in our area are issuing warnings to parents about letting their children watch the popular Netflix drama 13 Reasons Why. Well, experts at Dominion Hospital in Virginia say the primary audience should be adults.
Why should parents be concerned?
Hey, it's Hannah.
I think the concern is that the show is rated TV MA. It's really not intended for children. I think certainly children to watch alone.
And if you're listening to this tape, you're one of the reasons why.
Parents need to be asking their children if they're aware of the show, if they've seen the show. If they have, they really need to sit down and perhaps watch some of it together.
And what the series was able to do was to be able to bring an opportunity to open up the conversations with child and adolescents and their parents and their guardians or loved ones.
Dominion Hospital's Director of Social Work, Melissa Preston, says after you talk about the show, ask your teenagers about their social lives.
I think it's healthy to look at your child or adolescent and say, okay, what type of friendship or support network they have? How are your friends? Do you like the friends you're with? Do you want to make additional friends?
And having a parent on hand to help teens process the fiction versus the facts of life can help prevent an unhealthy understanding of the material, says Dr. Michael Reppy.
That's one of my main concerns about the series. We've done a lot of research in reference to contagion, and there are some definite correlates. There's increased likelihood of copycat suicides if there is a lot of exposure by the social media. If there is a peer of a young individual who has committed suicide, also increases the prevalence.
Especially if they've heard of other people committing suicide, it's like all of a sudden that becomes a problem-solving technique.
Licensed clinical social worker Rania Eid says a family history further increases the risk.
If other family members have committed suicide, the likelihood of other generations is definitely higher.
Which is why the team of experts here at Dominion's 116-bed behavioral health facility are encouraging parents to talk openly to their children about the risks.
This is the reality of the youth that they're
The
seeing.
series can be a catalyst for conversation, or letters like this, sent home from Maryland's Montgomery County school system.
What are the top causes of suicide among teens?
Isolation, feeling lonely, feeling like there's a lack of connection between themselves and their peers, feeling like they can't go to anybody or that they're not aware of the services out there, that they don't know what kind of help is out there, treatment programs.
And that's probably some of the greatest flack that Netflix has taken, was that the counselor in the show really missed these signals and missed out on the opportunity to act.
So whether it's a text, a social media post, or an off-the-cuff statement, this team of experts say any red flag should be taken seriously.
Youth suicide is the second leading cause of death for ages 10 to 24. That's significant when you're looking at our current demographics and the individuals that are viewing 13 Reasons Why, and looking at the exposure of those individuals that are in the school systems as well.
Another common behavior is making kind of final plans, making your rounds, kind of some last conversations with people, going to places that you frequently go to. So if you see any of those behaviors, certainly cause for concern and intervention.
What are some of the resources available for teens themselves to get help?
So definitely the National Suicide Prevention Hotline is available 24/7. Individuals reach out, call any time of the day.
Take a look at the screen. There are a bunch of resources if you or a loved one would like to reach out. To learn more about the services at Dominion Hospital specifically, go to www.dominionhospital.com.